Hello, my name is Kristen West, and I'm a speech language pathologist and an instructor at Edinburgh University's Communication Science and Disorders program. I'm here to talk to you about the field of speech language pathology, what a speech pathologist does, and a little bit about pursuing a career in speech language pathology if that is of interest to you. I'm also an SLP that still practices clinically in addition to teaching at Edinburgh University. So, first of all, what is speech language pathology, or what does a speech language pathologist help with? Speech language pathology is a field where we are dedicated to preventing and also assessing, diagnosing, and treating individuals that have difficulties with speech, language, social communication, cognitive communication, and swallowing disorders. And we do that in children's and adults. So, some things that we would address in the field of speech language pathology include fluency disorders or stuttering, individuals that have difficulty producing speech sounds correctly. So, maybe perhaps they say things like wabbit instead of rabbit, or they say tat instead of cat. Those would be difficulty producing the correct speech sounds. Problems with voice or resonance, so the quality of somebody's voice. So not when they're sick so much, but maybe as a result of having been in the hospital for a long time or having been ill and then their voice has never recovered. That would be something that we would work on. So maybe they have like a little bit of like a scratchy sound to their voice or a very soft, or they're not able to produce voice. That's something we would work on as a speech language pathologist. We also help people that might have trouble understanding others. So what we call the receptive language skills. Do they have trouble understanding spoken language, understanding what is said to them, or do they have a difficulty understanding written language as well? That's something else we could help out with. Um, or doing, we might help individuals who have difficulty sharing their thoughts or their ideas or expressing their feelings. We call that expressive language. So, do they have trouble combining words together into sentences, into stories? For children, or for maybe perhaps after an adult has had a stroke, they might have difficulty taking their thoughts and clearly communicating them to others. And that's something that a speech language pathologist would also help with. We would help with language issues like we talked about in both spoken language, but we also look at written language as well. So we would look at language from both angles. We'd also help individuals with social communication disorders. So when somebody has trouble using language socially, or using their body language appropriately to convey their meaning, also in understanding social communication. So knowing when somebody says, gee, it's cold in here, they're implying they would like a blanket or a coat, or can you turn up the heat, even though they're not directly asking. Or when somebody says, ask you if you're okay, and you say, yeah, I'm fine, that maybe what you're communicating is not actually matching exactly what you're saying. Picking up those subtleties of communication that are not just directly what you're saying. That would be part of the social communication that we would work on. Um, Cognitive communication disorders are something that we also work on. We would see this primarily or a lot of times in adults after they've had a stroke or a brain injury from an accident, or maybe some as they get older, as they age, or they are maybe have a diagnosis of dementia. Or something like that. So it's when somebody would have trouble organizing their thoughts, paying attention, remembering. So they might turn on the stove and walk away. How do we prevent that from happening at home to keep them safe? How do they plan things out? So you need to go to the grocery store, but you don't drive. How are you going to get there? How are you going to make sure that you get everything you need in that one trip to the grocery store? And then also problem solving. So, what do you do if you left the house and you can't remember if you turned off the stove? How do we address that? Or even in the planning or the sequencing of how do I go to the store and get what I need to make this recipe, and what are the steps to making this food that we might see adults have trouble with for a variety of reasons, whether it be illness, injury, or age. We also help individuals with swallowing disorders, what we call dysphagia. So when we've all had that experience when you're drinking and something goes down the wrong pipe and you start coughing and choking and sputtering. Some people have trouble with that because of illness or injury, and we don't want that to happen frequently because there's some negative health impacts or health side effects that could happen from that. So we help identify what's going on and then work on rehabilitating or fixing that if it's happening in adults. We also treat that in in pediatrics as well, or in children. Um, and we also help working on things like chewing up food appropriately. How do we work on those skills to appropriately chew the food so people don't choke, kids and adults, and working on those skills as well. The other thing that we help out with from a language standpoint is if individuals can't communicate verbally, we can help use things like iPads or communication devices, which are like computers that allow people to be able to express their wants and needs and thoughts and ideas. If they can't produce the speech verbally, they can use the computer or the iPad or an application to be able to communicate, to help them communicate as a tool. So that's something else that we really work on in the field of speech language pathology. So who do SLPs work with? We work with individuals across the lifespan. We can work from infants in the NICU working on swallowing and normalizing their development if they've been born too early, all the way to 100 years plus, those in skilled nursing facilities, or adults, like we talked about with dementia, or that have had some sort of medical illness that would require our services. So anybody that really needs evaluation or treatment for any of the things that we discussed on the previous side, we would work with them. We also work as a member of a team. Teamwork is really an important factor in this field of speech language pathology. We provide training and education not only to the patients, but also to their families and then any other team members that they might have. So like their physicians or their teachers or any caregivers, babysitters, daycare providers, about, each person's individual needs, the child or the adult's individual needs, and kind of giving them the up-to-date information about how to help their loved one. And then also for adults and older children, how to help themselves, or how to self-advocate, and what's just the information about what they're suffering with, or what they the diagnosis they have, to help them make individual decisions about their care. We also work with team members like OT, occupational therapy, physical therapists, teachers, physicians. SLP is really a field where we work collaboratively with others. There's a lot of social interaction, not only with you and the clients that you're serving, but also other professionals in your field. So it's a very social field. If you enjoy interacting with people and helping people, it's definitely a field that you might want to look into further. So where do SLPs work? We work in a variety of different settings. We work in education, so you might find us in preschools, or even in birth to 3 early intervention, in daycares. But we work in preschools, elementary, middle schools, high schools, helping students that have speech and language needs, like we discussed, through what we call IEPs. And that's one setting you can find an SLP. You can also find an SLP in a hospital, maybe inpatient, when somebody's sick, or maybe they have been sick and now they're in a hospital, but doing a rehab stay where they're working on getting stronger, and safe to go home. So you would find a speech language pathologist there. Or you can find us in outpatient setting. So where you make an appointment like you would at the doctor's, and you come in and get your speech on an outpatient basis, like where they would bring the adult or the child to you to provide services. And we can do any of those settings in a hospital setting, adults or young children. You can also have freestanding outpatient therapy clinics that aren't associated with hospitals or private practices, that you would find people owning their own business where they provide speech therapy. Like I said, we can be early intervention providers. So children that are between the ages of birth and 3, we would help them to develop their feeding, swallowing, and language skills as well. For adults, you might find maybe they aren't able to come to an appointment because they're too sick. They can't come to us, so we go to their house through home health. You can also find a speech language pathologist in a skilled nursing facility. And also, SLPs can work in the college or university level. So teaching students how to become speech language pathologists, and also providing services through a university clinic, and also researching information about how to best help individuals that have any of those disorders or disabilities we talked about earlier. How do we best treat them? We can also find SLPs helping perform that kind of research. So what is a typical day? A typical day for an SLP is really going to vary depending on what setting they're in. So I took 2 kind of examples of very different settings and kind of ran through what a typical day for an SLP may look like in that setting. So a typical day in a medical setting would be you would come in, you would have a list of patients you had to see, you'd go in, you'd read their chart, and you'd really see, okay, what do they need my help with? Do we need to work on swallowing? Do we need to work on communication? What happened to them? Why do they need our services? You would go see those patients, you'd evaluate them, figure out what you could do to help them improve and provide treatment. And we in a hospital would be on any floor. You could see us in the ICU where individuals are really sick, or the NICU in a children's hospital where the premature babies are, or an ICU at a pediatric hospital, or all the way through the regular, just short stay floors as well. We would complete swallow studies. That BFSS is a swallow study to assess the swallowing. So that's where, if you see this bottom picture, we put somebody in an X-ray machine and give them different foods and different consistencies. And through that imaging, we can look and see what are those structures and muscles doing. What problems are individuals having? What things can we do to help improve them? So just like in PT, you get exercises to improve your ability to run or walk, or maybe an OT to use your hands and arms. We look at what's going on in that imaging, because it's like a moving video of people eating and swallowing, and see, okay, what's going on there, and what can we do, what exercises can we provide or interventions can we provide to improve that, and then how do we provide therapy to help improve that. And that's something that we do with the help of a radiologist at the hospital. We also participate in medical rounds. So we evaluate and make recommendations for, what we think might best help a patient, but we also communicate that to other members of the team, like physicians, nurses, nurse practitioners, and other therapists like occupational and physical therapists. A typical day in a medical setting, you may also, on top of all of that, have a couple patients that you might have come to you. You might see outpatients. So they might come and see you for a couple therapy sessions a week or once a week to work on some skills. Maybe they've left the hospital, but they still need some support and they're going to come see you. That's something you might see in a medical setting as well, for a typical SLP day. And you also might see, okay, I'm working in the hospital. This patient I've been working on is ready to go home, but I still think they need some help with their swallowing, for example. You might then be communicating with the next level of care. So maybe they're not going straight home. They're going to go to a rehab facility where they're going to work on getting stronger before they go home. You might be communicating between you and that SLP at that next level of care, to say, this is what I've been doing with the patient, and this is what we've been working on to kind of help make sure that your patient continues to improve even when they're not with you at the hospital. And just like any medical field, you have documentation. So you have to document who you saw, what you did with that patient, and then billing. So we do have some time where we're spending in front of the computer, typing and documenting and talking about, what we've been doing with patients. So a typical day in a medical setting is going to be pretty fast paced. But again, it's going to be a very collaborative setting for a speech language pathologist to work in. And like I said, you could be in a medical setting for adults or kids. So this could be either. A typical day in an education setting. So maybe you work as an SLP in a school. What does that look like? You would see children for speech. You'd be working on a variety of different skills in any of those domains we talked about earlier. You could be seeing kids in a group, so with a couple other students, but you could also be seeing them by themselves. You could be seeing them in the classroom, working collaboratively with the teacher to improve and show progress towards their goals that you're working on, or seeing in collaboration with the teacher while they're working on their schoolwork, or you might be bringing them down to your room and just working in a small group just on their speech skills, or one-on-one on their speech skills alone. Again, in an education setting, the thing that's not going to be different is there's a lot of consultation and working with other team members. So instead of working with physicians, we're going to be working with teachers. We might be working with a school nurse, an occupational therapist, a physical therapist, just to make sure that students are making progress towards their goals, and then providing some education on what each student needs in regards to their speech and language skills to the other members working in the school. We also help support teachers and other school professionals to make sure that they're meeting the needs of the students who are getting our services, and to also get their input. This is how they're doing with me. How are they doing in the classroom? How can I continue to help support their developing speech and language skills? In an education setting, we're also going to have a lot of meetings and teamings, but they're going to look different. We use different documentation. So we have meetings between all of the school staff and families to talk about how the children are doing in speech therapy services. We can provide training to other staff members or in services, which is just training and support about, what speech and language and what we can provide to the school-based team. And we do a lot of communication with parents and also other providers in the community to just talk about how the students are doing in school, but then also how they're doing with their speech and language goals out in the community, maybe if they're getting outpatient services, and then also what the families can be doing at home to help support their children's needs. Just like in the medical setting, though, we're going to be writing notes, documenting what we've done with students, and then making sure we're tracking progress. We're always looking at what are we working on with our patients or our students. Are they making progress, and making sure that we have to write that down. That is a part of our daily job as well. So, in the field of speech language pathology, what is the job outlook? Is it a growing field? Is it hard to get into? Are jobs available? That's definitely a good consideration when you're thinking about what do I want to study for my career. So, according to the U.S. Bureau of Labor Statistics, when I looked this up most recently, jobs in the field of speech language pathology are projected to increase by 25% between 2019 and 2029. So the US Bureau of Labor and Statistics says that's actually a rate of job growth that is much faster than average. So SLP is a growing field with a high demand for professionals and a lot of jobs available across the country. So it definitely has a good job outlook if you're interested in learning more about this field. What is an SLP compensated? Compensation is going to vary depending on where you live and cost of living and things like that. It can vary, but the information that we have from ASHA, which is our national organization, the American Speech and Language and Hearing Association, they did a survey in 2015 looking at SLPs that work in a medical setting, and in a survey in 2014 looking at SLPs that work in an education or a school setting. So across the entire United States, the annual salaries, so yearly salaries for an SLP working in the medical field were between $70,000 and $93,000, depending on how many years they had been in the field and the geographic region that they work. That was about the average. And then in schools, because you're not working a 12-month contract, you're working like 9 to 10 months. The average salary is about $60,000 to $72,000 a year. Again, I said it's going to vary maybe depending on where you live, but that's typical compensation for a speech language pathologist. So, what are some advantages of a career in speech language pathology? It's a growing field. The need is continually increasing. I have been in the field for over 10 years and have seen the demand for speech language pathology services and jobs continue to grow during my time in the field. Um, the other thing that I think is a real advantage here is that there's a variety of options in terms of what setting you want to work in. So myself, I've worked with adults in the past in skilled nursing facilities. I'm just helping out on the weekend. But I've also worked for children that are admitted to a pediatric hospital. I've worked outpatients where the children come in to see me. And most recently, I've worked in an educational setting, so in a school or an early intervention preschool setting where I'm working more closely with teachers. And I've been able to move around the field that way. The other thing is that you can kind of work across the lifespan. So you can start out working with children, then decide you want to work with adults. There's always something new to learn or the ability to change within our field. And I think that's a real advantage of speech language pathology. There's always an opportunity to learn and grow. So if you love constantly learning and you love to be challenged and try new things, that is always going to be available to you in the field of speech language pathology. If you like to learn and grow, there's also, like I said, opportunities to learn, to study the interventions that we provide and figure out how to do them better through research. So that's really another angle of our field that is constantly growing and evolving. And it's really interesting to be able to participate in that side of the field, but also be able to learn about it and then apply it to the patients and the clients that we serve. Speech language pathology is really fast paced. It's team oriented. So if you enjoy being personable and interacting with others, it is definitely a field that you might want to consider. So Now that I've told you a little bit about the field, if you're interested and this sounds like this might be a good fit for you or something that you want to explore further, how do you become an SLP? What are the steps to becoming a speech language pathologist? So you need an undergraduate degree in communication sciences and disorders. It's the clearest route. You can have an undergraduate degree in something else, but you're going to have to take a year or so of precursor or prerequisite courses at the undergraduate level before you could get your master's. So the clearest path is you get an undergraduate degree in communication sciences and disorders, and then you have a 2-year master's program in speech language pathology. Communication science and disorders is an undergraduate degree that looks at speech language pathology and audiology together. But if you want to become a speech language pathologist, you're going to enter into a master's program specific for speech language pathology. And that's a 2-year program where you're not only taking coursework, but you're also learning to work with adults or children under the guidance of a certified speech language pathologist, learning how to provide the therapy and how to do the interventions that you're learning about in your class, in the classes that you're taking. So it's a pretty hands-on master's degree where you are learning in the classroom and then going ahead and applying those skills in the clinic or in your clinical placements. And so during those clinical trainings, you get to train in a variety of different settings, like we talked about earlier. So you could really get to see the depth and breadth of the field in this master's program. And then after your master's, you have what's called a 9-month clinical fellowship. You essentially go out and get a job, but there will be a SLP who's been working in the field for a number of years that is going to be there and serve as your mentor to help you learn on the job while you're getting paid. That is supervised for 9 months, and then when that's completed and all the paperwork is submitted, you become a certified speech language pathologist, or you get your certificate of clinical competence, which is what that CCC stands for in CCC SLP. So it's a 2-year master's where you go out and work 9 months with some supervision and support from a seasoned speech language pathologist. At the end of that, you have your certificate of clinical competence as a speech language pathologist, and you are then working and practicing independently. And you just keep up your licensure and continue to take continuing education credits to continue to learn and grow in the field each year. So if you're interested in pursuing a career in speech language pathology or starting to study communication science and disorders, what is a piece of advice that you have for you? I was able to actually tap into one of our undergraduate students who has decided that they are interested in our field, and this was the piece of advice and guidance that she had. She said she really realized that she wanted to study in the field of speech language pathology because she got some hands-on experience. She was able to actually pair up and do an internship with a speech language pathologist during high school. And she did that in her own school district. And she found that she really loved the atmosphere and the hands-on aspect of therapy, and really loved what she learned from that internship. And it really kind of gave her new insight into the field. And she said, taking any internship opportunities that you have was something that if you think you're interested, she thought that was really helpful for her to learn more about the field and see, what it looked like in practice, and really confirm to her that this was what she wanted to pursue and study. So if you think you want to become a speech language pathologist, what kind of classes would be helpful for you to take in high school? Anything science-based is going to be helpful. Anatomy and physiology, biology, physics, psychology, those are all related fields and studies that are really going to help give you a foundation to pursue a communication science and disorders degree and on your road to becoming a speech language pathologist. If you want to learn more about the field of speech language pathology and you're interested after hearing this presentation, you can feel free to contact me. This is my email. My personal email you can contact me at kristenmwest@gmail.com. You can also visit our national organization's website, www.asha.org. They have a lot of information if you go under the public tab that tells you about the field in general, where SLPs work, and goes into more in depth than I was able to go into today. They also have information for prospective students. So if you're interested in studying in the field, it's a great place to go look. And if you want to kind of see more about our program at Edinburgh, or even just learn more about the field, we have an Instagram account as well that I have provided you the Instagram handle for below. Thank you so much for coming today and listening to my talk about the field. And I wish you all well during this crazy time of 2020.